Hi there, Mark Jabin here, Medical Director for the Haywood County Health Department, and let's talk about this pandemic. In today's video, given the recent increase in cases, it's a good time to revisit what to do if you get sick or exposed, because this, not vaccines, is the key to limiting spread in this time of increasing cases. So please share this with someone you care about. There is no doubt that vaccines are a huge part of the Swiss cheese model needed to control this virus. But for so many not yet fully vaccinated, this doesn't really help right now. And for those not fully vaccinated, if you are at risk this winter, well, you're at same risk right now. The best way to manage getting infected or exposed is to not get infected or exposed. How do you do this? Avoid being in close contact. Within 6 feet of someone positive for more than 15 minutes, not wearing a face covering. And because a person can be contagious a couple of days before they get symptoms or even know they are infected, the time to avoid being a close contact is all the time. Even those who care about you cannot know they are a risk to you, and the same for your risk to them. Wherever you might encounter a higher concentration of virus in the air, that's the time to be in place to be careful. Indoors, lots of people who you cannot know where they have been or what they have been doing or not doing, especially if the ventilation is not so good. This is the time to limit your time there. Keep your distance. Wear your mask. If indoors, you should be able to feel air circulating. And better yet, gather with others outside. But what if it turns out others there were contagious and you did not avoid being in close contact? At this point, too late to avoid it. Now your focus has to be on not giving it to someone else. Quarantine yourself for 14 days. Yes, it's still 14 days because anytime during this period you might still develop symptoms and get sick. And that's a long time, but that's what is necessary and why you want to avoid being in close contact and even having to quarantine if you're around someone who's positive. That means, quarantine by the way, means separate from others, especially family. Stay in a separate room, better if you have a separate bathroom. If you must come in contact with others, everyone wear a mask. Keep your distance, limit your time around them. And if you can't do all this, call the Health Department call center, 356-2019. There are places available if you can't do this at home. Get tested on day 5 to 7 after your exposure because it takes some days for the virus to grow inside you enough for the test to be able to detect it. Test too early, and the test may not be able to show it even if you are infected. The result won't change the 14-day period. But if you turn out to be positive, others might have been in close contact with you and they may need to quarantine. Remember, the goal now is to not give it to someone else. Be responsible to those around you. The best way not to have to do all of this is to not have to do it to begin with. And that's why you want to avoid being in close contact all the time and not get caught up in this tangled web. But let's say you do get sick. Isolate immediately. Same as above, separate from everyone else. Even if it is only mild allergy symptoms or sinus congestion. But is it really? Get tested. Remember, a rapid antigen test is only reliable if positive in the first 5 days of symptoms. A negative test or a positive test outside those limits or a positive test with no symptoms tells you absolutely nothing. A PCR test takes a few days to come back, currently around 2 days. Isolate until that result comes back. If positive, you are eligible to no longer be considered a risk to others or contagious when it has been at least 10 days since symptoms started, or 10 days from the results if no symptoms, no fever off any fever-reducing medicine, and improved symptoms. The health department continues to contact and advise those who test positive. And this week we will again start contacting close contacts and advising their quarantine. So now's the time to commit to being responsible to your family and your community. If our increased case counts stay low enough, we could still be set up well for the late summer and fall to safely relax restrictions. But that depends on what each of us does. So be well and be careful, especially right now.